Thanks very much. I've got some very positive news today, but sadly some negative news as well. I'll get to that as soon as I can, and the Chief Health Officer will speak to the rationale behind some of the very difficult decisions that we've made this morning. First things first, there are 423 cases. They're all locally acquired. That takes us to a total of 4,038 active cases across Victoria. 149 of today's cases are linked. The rest are being investigated by our public health team. Sadly, we have to announce and confirm that there have been 2 deaths, a man in his 40s from the Whittlesea area and a second man in his 70s from Wyndham, and we extend our deepest sympathies and condolences, and we extend those sympathies to their families and indeed to all of their friends, and they're in our hearts, our thoughts and prayers today. 84% of all our cases are under the age of 50, and 1/4 are in their 20s. So this is going where the vaccines aren't. This is going to that unvaccinated, that is a pandemic of the unvaccinated. That group is still a very large group. It is getting smaller by the day though, and that's why it's so pleasing to be able to report that we have surpassed the 1 million vaccines, 1 million doses in 5 weeks. We're a couple of days ahead of target, and I thank each and every one of those Victorians who've gone through state hubs. That's 1 million jabs over less than 5 weeks. As we had indicated our target 1 million, we've reached that, we've exceeded it. Thank you so much to all of those who have come forward and got vaccinated. You're playing a massive part in keeping yourself and the rest of the community safe, avoiding serious illness, getting us opened up, getting us back to normal and getting us the freedoms that we all value and cherish and desperately want, perhaps more now than ever. There are 173 people that are in hospital, 44 are in ICU, 23 are on a ventilator. We send our best wishes to all of those patients, and we send our thanks again to the teams of dedicated professionals who are caring for them. Our challenge is, as a community, not to make the work of those dedicated professionals any harder than it already is. We know there are going to be more cases. We know there are going to be more people in hospital. That's an inevitable consequence of delivering the national plan, a plan that we help write, a plan that we are faithful to, a plan that we want to deliver in its entirety, and we will. But that is predicated on the notion of getting to a point where we have to open up, and that will see an inevitable increase in cases, an inevitable increase in hospitalisations, and that'll mean the work of our nurses and others will be hard. Very, very hard work. It is every day in many respects. We just have to get the vaccination numbers up as high as possible before we open up. Again, all countenanced, all clearly outlined in the national plan. Otherwise, it's not really a fair fight. We can manage, although it will be tough, a pandemic of the unvaccinated if that unvaccinated group is as small as possible. We're not yet at 50% double dose. The notion of opening up now is not only irresponsible, it is dangerous. It is not what the national plan calls for, and it is not what our government will do. Any suggestion to the contrary, well, that's not in the national plan. Far from it. It is wildly variant from the national plan, dangerously so. Can I just, on the 1 million, as I indicated earlier on, we have delivered that ahead of schedule. We find ourselves at about roughly 68.3% of Victorians have had their first dose. We're still below 50% double dosed, but what that means is that the 70% single dose number that we had pegged a number of modest changes to, that's fast approaching. That's good news. That means that so many people are coming forward and getting vaccinated, and we will have options at the 70% single dose. And then, of course, we have many more options at 70 and 80% double dosed. That's what the national plan calls for, and that's what we'll outline in our roadmap on Sunday. Now, I am pleased to be able to confirm that thanks to the great work of the Shepparton community and looking out for each other, sticking together, getting tested, getting vaccinated, staying at home and isolating away from others, they've done an amazing job, and now 3 days with no new cases. Shepparton will be able to join the rest of regional Victoria and be open with those limited opening settings from 11:59 p.m. tonight. That is a credit to the people of the Goulburn Valley, and I send my best wishes and my thanks to each and every one of them. They've done an amazing job. In less good news, we have a number of cases and a number of wastewater detections in the Ballarat area, And from 11:59 p.m. tonight, Ballarat, the city of Ballarat, will have to go back into a lockdown for 7 days. The Chief Health Officer will speak to the logic behind that and the epidemiology behind that. What I want to say to the people of Ballarat is, just like the people of Shepparton, I know the people of that proud city will stick together. They will look out for each other. They will support each other, and we will be there to support them. There will be, and Jerome will speak to this, there will be extra testing. It's still symptomatic people and people who have been to exposure sites. We're not moving to asymptomatic testing at this stage, but we will expand sites, we will expand operational hours, we'll make it even easier to go and get tested. We're also going to have additional vaccines go into the Ballarat area. They are right on the 70% single dose already. We want to use this 7-day period to vaccinate as many people as we can beyond that. And Jerome will be able to speak to some of that today. Some of those details won't yet be finalised until tomorrow. This is essentially, as the Chief Health Officer can take you through in more detail, if we have cases get away from us in any one part of regional Victoria, then it will ultimately compromise all of regional Victoria remaining open. This is not the news the people of Ballarat want to hear, and it's not the decision that we wanted to make. But if we allow it to get away from us in one part of regional Victoria, it becomes a threat and a risk to all of regional Victoria. We simply can't have that happen. Shepparton shows you that a community can be locked down, can stick together, can be supported and deliver fundamental control of an outbreak. We know, and we're very confident, that that's exactly what can happen in the Ballarat community, but the alternative is to let it run, and then we finish up in we have no choice but to, not today, but perhaps in a week's time, we have to close all of regional Victoria because cases have got away from us, and there are patterns of movement. Ballarat is not a community that's shut off from everybody else. People move to different parts of regional Victoria, they move to Melbourne. Those patterns of movement would mean the virus would hitch a ride and potentially, if unchecked, spread right throughout regional Victoria and compromise the very low numbers of cases in regional Victoria right now, which is why there are some, regional Victoria is open, albeit not fully open, but certainly more open than metropolitan Melbourne. We have to safeguard that low virus status and those settings. So mixed news today. Great news for Shepparton, not so good news for the people of Ballarat, but we will support them, and I know that they'll support each other. It's a community that I know very, very well. They're an impressive, proud community, community that does stick together, and with our support we'll get through this over the next 7 days. People will come forward to get tested, I know that. They'll also come forward to get the jab, and we will get through this together. The 1 million, some thought that, I think, quite an ambitious target. We've not only delivered it, but we've done it ahead of time, and that's all down to the amazing work of our nurses and all the other teams who are working in vaccination hubs, and the fact that so many Victorians have come forward and taken that positive step to protect themselves, to protect the rest of the state, and to get the state open. That we will have more to say. I can't today lay out what the next target is, because we're just waiting on the Commonwealth to confirm for us. We should have in the next couple of days confirmation of all the doses that are going to come to us in October. Until I get that, I can't settle on whether it's target 500,000 or another target 1 million and over what interval period. But we'll be out on the weekend as part of the roadmap talking about what our vaccination targets are also. So I now might ask the Chief Health Officer to speak to the kind of architecture of the outbreak, all those different chains of transmission as he normally does, to speak directly to why Ballarat. This is the advice he's provided and the decision we've made. And then Jerome can speak to how we're going to support that local community with testing and additional vax. And then we're happy to take any questions you have.
Thanks, Premier. Firstly, to vaccines, if I may, it's just a fantastic achievement to get to the 1 million mark ahead of that 5-week milestone. To have so many vaccines in arms in Victoria is an absolutely tremendous achievement. Every vaccine's another brick in a defensive wall against coronavirus, and it's another step on the way to those increased freedoms that we're all looking for. We have seen outstanding vaccination growth in coverage in some key areas in the past fortnight, First dose coverage, for example, has grown by 38% in the City of Melbourne over the fortnight. That's a tremendous increase, a necessary increase because it was coming from a relatively low base. There is a young resident population in the City of Melbourne, but that increased coverage, again, is just a fantastic defence against the virus. It's grown by 35% in Hume and in Wyndham, and we've seen a 30% growth in Greater Dandenong and in Shepparton, and 28% in both Casey and Melton. That's a terrific achievement in just 2 weeks, and it really will contribute to slowing the spread of numbers in those local government areas. With respect to Ballarat, as the Premier said, there were signs of concern there. We've got 2 positive cases who were authorised workers who work in Ballarat, and today we've got 2 new cases who reside in Ballarat, household contacts of a case announced yesterday, and there are likely to be more cases. We've had positive wastewater detections from the 8th, and as we've said previously, that can sometimes mean someone passing through, someone who's recovered, but when subsequently you've got confirmed cases identified, that does make you think that those wastewater detections related to someone who was positive and infectious and not detected in the community at least back to the 8th and probably for some days before that wastewater pings positive. So it's been over a week of likely transmission within the Ballarat community. So there are likely to be more cases, and it's for that reason that going to an immediate lockdown is really the right response. Again, in line with the national plan, the national strategy for the shortest, sharpest lockdowns possible. It does give Ballarat the very best chance of opening up again in the shortest possible time. Flagging a week, hopefully as soon as possible, lifting thereafter. And again, Shepparton has shown us the way that you can control even the Delta variant, even with dozens and dozens of cases, if you can quarantine all of those contacts, get very high rates of testing and drive vaccination all at the same time. The uptick in vaccination in Shepparton, obviously a response to the significant cluster there, but this is a point to make. If you are only now thinking of getting vaccinated because there are cases in your community, in your local government area, in your town or city, that should be a reminder to you that you need to book in at the earliest possible time. Don't wait for a case. They could come at any day, anywhere in Victoria, indeed anywhere in Australia. So please, if there are bookings available, make that booking now, because your first dose gives you some protection, but it takes a while to kick in. Your second dose is going to come 6 weeks later, and you'll need another fortnight until your immune system has kicked in to give you that full protection from hospitalisation, from risk of dying. So you've got about 8 weeks from that first decision to book in your first vaccine until you've got proper protection. So please don't wait for a case to pop up, for a lockdown to occur in your town or city before you say, oh, now I really need to get the vaccine. Not blaming anyone, I'm saying it's a lesson for everyone in Victoria, indeed everyone in Australia. If there are opportunities for you to get vaccinated today, tomorrow, please do so. With respect to Ballarat, there are a number of exposure sites on the website now, including the Lakeview Hotel in Lake Wendouree on the 9th and 10th between 7:15 and 7:55 in the morning, and again on the 10th between 9:45 and 11:30 a.m. The Big W in Ballarat on the 10th, 4:45 to 5:30 p.m. and the Forge Pizzeria in Ballarat, which is a pretty busy place in normal circumstances, on the 11th, from 2:50 to 3:30 in the afternoon. As I say, there have been additional wastewater detections in Ballarat, and they do cover all of the wards of Ballarat. So that was part of the decision-making, recognising that there's probably been more widespread transmission than has been detected thus far. So if you're in Ballarat, please stay alert, be aware of symptoms, get tested if you've been to any of these exposure sites, or if you've got even the mildest of symptoms, and if you've got that opportunity to get vaccinated and you've got no symptoms and you haven't been to exposure sites, please step up for the vaccine. There is a walk-in testing centre at the Ballarat Respiratory Clinic on Dana Street and a drive-through on Skipton Street. The great majority of people in Ballarat have had 1 dose of vaccine. That's a fantastic starting point. But if you're not amongst them, please get amongst them. obviously it's a very challenging time for the Jewish community. This is the holiest of holy days on the Jewish calendar, and for the community not to be able to observe Yom Kippur in the way that they would like to do with such a significant day, not to be able to be in their synagogues is really difficult, especially given that the use of technology is not something that would normally be permitted for religious services in the Jewish community. We do want to thank the Rabbinical Council of Victoria for representing the Jewish community at such a challenging time. And from me, from all of us, we do wish the community Shana Tova and a Happy New Year, and to be well over this period. Thank you, Jerome.
Thanks, Brett, and good afternoon. So of the 423 cases today, that gives us now 4,035 active cases of coronavirus here in the state of Victoria. As the Premier said, there are 173 Victorians currently in hospital with COVID, of whom 44 are in intensive care and 23 of those are on a ventilator. And we, of course, send our very best wishes to all of them as they recover from COVID over the days and weeks ahead. With the distribution of the outbreak is very similar to what we've seen over really the last couple of weeks. So in the northern region, we have 274 positive cases in our northern suburbs. That includes locations such as Craigieburn, Roxburgh Park and Glenroy. In our western suburbs, we have 112 cases, so just over a quarter. In suburbs such as Truganina and Tarneet and Point Cook. There are 10 cases in our eastern suburbs across Croydon and Donvale. And there are 25 cases in the southeast of our city, in Keysborough, Dandenong and Clyde North. There are 5 regional cases. Brett has mentioned 2 of them, obviously in Ballarat. The other 3, we have a case in Geelong, which is a primary close contact, a household primary close contact of another case, well locked down and isolating. And we have 2 cases, again, primary close contacts, household contacts in Mitchellshire, again, both isolating at this time. And that gives us our 423 cases. If I look at all of our active cases across the state at this point in time, 88% are in our northern and western suburbs in those really well-defined postcodes of priority that we're focusing on. And again, my thanks to all the teams supporting the community in those postcodes. It's a huge effort across local councils, civic and community leaders, and of course our public health teams working to support people in those areas, those who are still living with COVID and doing those hard isolation protocols as we go through. We still have 61 active cases in total in regional Victoria. Some of those, of course, we've mentioned in Geelong and in Ballarat, but the vast majority continue to be in Shepparton. They are, of course, under very tight isolation protocols, and it's all around our confidence around the controls in place that allows us to now move towards easing off Shepparton, but also we're now very keen to understand what else is happening in the Ballarat area. I'll call to 4 particular outbreaks of concern. The Box Hill construction site, we've had a further 10 cases. That's now up to a total of 146 for that outbreak. We are now doing day 13 testing, so those 10 cases came out of day 13 testing, and that work continues on. At the Fitzroy Community School, we have a further 5 cases. We're now up to 38 cases in total for that school. I am pleased to report that there are 76 primary close contacts. 8 out of 10 of those have now returned a negative test result, so hopefully we're starting to see the bottom of the barrel in terms of the number of cases we expect to see with that particular outbreak. The school, of course, continues to be closed as we work through the isolation protocols with the remaining positive cases and primary close contacts. The outbreak across the V-Line organisation, we now have 6 staff in total who are positive cases. So we've had 2 more positive cases in household contacts over the last 24 hours. 199 other staff members are primary close contacts, and of course my thanks to the V-Line organisation for the work they're doing to bring back train services and coach services whilst those 199 staff go through their testing and isolation process. And finally, we have 7 positive cases associated with the Oporto restaurant at Coolaroo. That includes one of the cases in Mitchellshire who's associated with that particular site. In terms of wastewater, of course, as Brett has spoken to, wastewater testing has been really important in terms of identifying our concerns around the Ballarat area, with the wastewater triggering now in 3 different catchments in and around the city of Ballarat wider area. We've also had a positive wastewater detect for Aries Inlet and Fairhaven since the middle of last week. So if you're in the Fairhaven and areas in that area, if you are symptomatic, then please make sure use this prompt to come forward and get tested. Barwon Health will be setting up some additional testing facilities in the area to make sure you can do so easily. In terms of testing, another big day, 54,000, almost 54,500 tests today. That brings us to, during the course of today, we will hit the 2 million test mark for this particular outbreak. We've seen really strong and consistent testing demand, particularly across the northern and western suburbs, but also in other outbreak locations such as Shepparton, and I'm sure we'll see a very busy day in testing in Ballarat and again over the next few days. My thanks to everybody who's coming forward so promptly to come and get tested. That, of course, allows us to build that really clear picture of where the outbreak is the most active, allows us to get support to you if you're testing positive and your household and family members. We continue to see good demand across our network, but also waiting times are all listed on our website. And again, I ask you to please check your nearest testing station before you set off. We are moving some of our testing sites around. There's an additional testing site set up today in Craigieburn at the Splash Aqua Park. That'll be available. We'll continue to run that for the forthcoming days. And the testing stations in Tarneet and Hoppers Crossings will be extended, will run extended operating hours until 8 p.m. today. Finally, with regard to Ballarat, the regional response team has now been activated to support the Ballarat outbreak. We went through a very similar process, of course, with our outbreak in Shepparton, and we have regional response teams active also across our metropolitan area dealing with those significant outbreaks. That team is meeting later on this afternoon. It includes, of course, critical partners such as the local council and local health services, but also all the relevant arms of government, including, of course, led by our public health teams, but also across VicPol and Department of Family and Housing Support and other services. The job of that regional response team is to provide full support to the wider community around Ballarat, making sure we can support you as we go through a really big testing drive and vaccination drive over the days and weeks ahead. And we'll work and ensure good and effective local communications and coordination of a wider support effort. We are working through setting up additional testing capacity across the city of Ballarat at this point in time, and we will be running extended operating hours for some of our testing sites. I'd encourage at this time, anybody in Ballarat who is symptomatic, please come forward and get tested. And if you've been to those exposure sites that are listed on our website and that Brett's talked to, please again come forward to get tested. We will, of course, encourage other people over the coming days to get tested in Ballarat, but for now we'd really like to focus on those who are symptomatic and who have been to those exposure sites. I am expecting a busy day in Ballarat from a testing point of view. We will be with you over the days and weeks ahead, so please don't rush forward to get tested if you don't have those symptoms at this point in time. Finally, in terms of vaccination, 69% of the population of Ballarat, of adult population 60 and over, have had their first dose vaccination so far. There are 1,500 first dose vaccine appointments available in and around the Ballarat area at this point in time. So I would encourage, if you haven't yet had your first dose vaccination anywhere in Victoria, please book it. But particularly if you're in Ballarat, please use this as an encouragement to come forward and get that first dose vaccination done. We are sending thousands of additional doses of vaccine to Ballarat over the coming days, and we'll make more announcements over the next 24, 48 hours in terms of where those doses will be allocated, so that people can come forward and use this as a quick surge to boost the vaccination rate in Ballarat and to get through this outbreak. With that, I'll hand back to the Premier for questions.
Premier, we've abandoned COVID zero. Both of the new cases in Ballarat today were household contacts, and they've got one of the highest first dose percentages of the state. Was a lockdown was a full lockdown really the only option?
Yes, it was, and that was the advice provided by the Chief Health Officer. And if we have it get away from us in one part of regional Victoria, then all of regional Victoria will be closed. And just think about that. People don't just stay in one part of the regions. They move, they travel, they work. This has come from authorised movements. There are other authorised movements and a freedom of movement across regional Victoria that would see this spread. We know that. New South Wales did a very similar thing just the other day. This is what the national plan calls for, targeted lockdowns in order to preserve the low virus status of a larger group. No one wants to make this decision. We will support the people of Ballarat. There'll be further business support, which is still not expired from the announcements that were made previously, despite the fact that Ballarat has been open for a short period of time. We didn't revise down those business supports. They're still being paid. But there'll be further announcements made quite soon. If there was another way, if there was different advice, then the Chief Health Officer would have provided it, and we would have followed that.
Given regional Victoria has lifted its restrictions, are we confident that the virus has been contained to Ballarat? Are you concerned that it might be in other parts of regional Victoria?
Well, we don't have 0 cases in regional Victoria. We have some cases, and where we have control of those chains of transmission, where we're confident that we have control of those outbreaks, those communities remain open. When we get the very clear sense from both what we know and what we can reasonably deduce via, for instance, sewerage testing, that there are cases out there that are not yet, haven't been tested yet, are not yet known to us, they're not formally part of the outbreak, but we know and suspect that it's bigger and broader than it might appear. That's when these very difficult decisions have to be made. And as we all know only too well, if you wait a couple of weeks to be proven wrong or right, you know, if you hesitate, then you finish up with many, many more cases, and then that's what potentially puts at risk the status of all of regional Victoria. You know, I want to be able to take further steps to open up regional Victoria even more in coming weeks. That's what I want to be able to do. But first of all, we have to safeguard their low virus status. And yes, there'll be cases, but if they're known, if they're isolated, if we don't believe on all the available evidence that there's something else going on in the background, then regional Victoria can remain open. For instance, there are still cases in Shepparton, but they've been in ISO. They've cleared through their day 13 testing. Some have had to do 2 lots of ISO. They're not yet through the second lot of the 14 days that they've had to isolate away. Shepparton shows you that this approach works, but everyone's got to work together. And of course, there's a big job for us to do to support the people of Ballarat. I have a lot of family in that part of the that part of the state. Many friends as well. This is not the news that I wanted to be giving that particular community, but we will stand with the people of Ballarat and we will support them just as we have the people of the Golden Valley, and they'll get to the other side of this.
There are more active cases in Geelong, so why Ballarat?
Well, again, I've just made the point, I think, a number of times. There is a sense of control in some parts, and there is a sense where there is perhaps not control. To speak to the differences between Geelong and Ballarat, which I think he's already done, but he can speak to it again, I'll throw to the Chief Health Officer.
Yeah, certainly there are a number of cases in Ballarat. They are all linked. They are all understood as to where they acquired their infection. A number of them were infectious actually during the lockdown period before Geelong came out of it and had very minimal exposure sites. Almost all of cases in the last several days have had their entire infectious period in quarantine. So they are identified primary close contacts. That's what the Premier is referring to in regard to control. They are controlled cases because they haven't led to additional exposures across the city.
What about that Surf Coast area? We've had a few exposure sites listed there in the last few days as well.
Yeah, we're concerned. We're always concerned when we get a wastewater detection or if there have been exposure sites for people to come forward if they've been to those exposure sites or if they're symptomatic. So the call out for those on the Surf Coast in that wastewater catchment is a clear indication that we want to try and find any cases who might be out there and identify if there are exposure sites, if they're a recovered case or any other explanation. But yeah, it's always a concern to have a signal that might indicate an undetected positive case.
Are you concerned about isolation in Blight, New South Wales? A couple of venues have been closed down there. Is that of a concern to you?
Again, any exposure sites are a concern, but when we haven't detected additional transmission, so cases popping up in the community, there is a sense of control. We know that if we can flag exposure sites very early, people can come forward for testing, having been to those exposure sites, and to be immediately quarantining as someone who's visited a Tier 1 exposure site in particular, then there is that control. But you know, these exposure sites are going to buffet regional Victoria for some time to come, especially as case numbers increase in metropolitan Melbourne. That's why everyone needs to be on alert.
From Ballarat, a link back to Melbourne at all?
Yes, we know that you know, the overwhelming likelihood is that they're linked back to Melbourne. For some, they're already defined, but as I say, for those who we haven't detected yet, it's hard to say.
Are there any other regional communities on notice at all?
Essential workers that have come from Melbourne?
So two of the cases have been authorised workers who've come from Melbourne, yes.
Are they construction workers?
I'm not sure of the status.
How did you land on this set of rules? For example, why is the curfew not applying here?
Oh, really, the The curfew was an additional measure where there's very, very high transmission in Melbourne, where cases have been in the 400s for days, and the trajectory continues to go up and will likely do so. When you've got just a couple of cases, your overwhelming means of control are through the contact tracing and the isolation and quarantine that cases undertake. When you've got very widespread transmission, where the majority of the cases that come through every day aren't necessarily linked, then you need every other measure to suppress those numbers.
How many people are down in Melbourne at the moment? And we've had record testing for the week so far. Does that line up with the burnout modelling you've seen? Do you believe we may have peaked in terms of our outbreak?
No, we haven't peaked, unfortunately. Look, the burnout modelling and everything we know in relation to our current vaccination coverage would suggest that cases will continue to increase. The fact that they're being held in the 400s, again, a testament to everyone in those suburbs and who's isolating and quarantining, and to the contact tracing work that's being done. But it's a very hard number to keep under wraps, and vaccination alone won't mean that there's a peak at the 400s.
Are we?
How many? Expecting that peak to get? Are you expecting us to get over 1,000, for example?
For Melbourne, look, it's very hard to know. We've had a higher growth trajectory in the previous week. It seems to have stabilised a little bit in the last few days, but we don't know where that true number is. The risk of it getting to 1,000 is real, so we have to press on with vaccinations at the fastest possible rate for that reason alone.
How many people are in isolation in Ballarat, and do you project that to increase? And how do we avoid a Shepparton-like scenario where essentially a third of the town was in ISO?
Look, I guess we've got some assurance. We haven't got a school outbreak where it just puts hundreds and hundreds of families and their close contacts into quarantine. So I think that's a positive. But how many will end up as being primary close contacts, really hard to say. We've got these 4 cases. We'll identify their household contacts. They'll be in quarantine. But it's through all the testing that will happen through the course of today and tomorrow that we might identify another 4, 5, 10 community cases. We don't know for sure, and they will have generated a number of close contacts because it hasn't been in lockdown.
And going forward, is this the pro forma? Is this the criteria now for a regional town to go back into lockdown if they have 4 positive cases that you don't know everything you need to know about?
Yeah, look, we have to take each and every situation on merit, but it was that combination of a number of cases, transmission beyond households, a number of exposure sites, and broad wastewater positive detection that actually goes back a week or more that are those elements of concern.
The family of a Craigie man in his 20s who died, they say, of a cardiac arrest, has been later diagnosed as having COVID. Are people being misdiagnosed, and do they need to go into isolation as a result of that?
Anyone who's a close contact, and look, my absolute sympathy to this family. They're going through the most difficult time, and they'll not be able to attend a funeral in person as primary close contacts. But anyone who's a positive COVID case will have close contacts, and those close contacts must quarantine for a 14-day period, regardless of what the ultimate cause of death is determined to be. I don't have draft, and there are no final coroner's findings in relation to this case. But anyone who dies will have a diagnosis of cardiac arrest or respiratory arrest or cardiorespiratory arrest. That's a cause. That's an immediate cause of death. But COVID was the underlying diagnosis here, and it's for that reason that there are close contacts who need to quarantine.
So in New South Wales, they're identifying people who have underlying health conditions who have sadly passed away. Is that something that should be done in Victoria?
Oh, the same process applies. Anyone who's died from COVID, even if diagnosed post-mortem, will have a look into whether there are significant underlying conditions. They do make you more vulnerable, there's no question, especially if you're unvaccinated. But it's not the only cohort of individuals who are at risk. There are people with no pre-existing conditions whatsoever who are absolutely at risk as unvaccinated individuals in particular. If you're fully vaccinated and you've got no underlying conditions, and that's about 60% of the population, it's certainly not the overwhelming majority, are at risk.
Can you give us an update on this 17-year-old? As a 17-year-old mentioned about a week ago, who was on a ventilator, and also an infant.
I don't have updates on their clinical status, but we can get you that.
Just back on the man on his 20s, why would we consider it or classify it as a COVID death if we're not entirely sure if COVID was the cause of death and it's evident he might have underlying comorbidities?
We've not classified it as anything. The coroner will make their determination in relation to the exact cause of death, but it's a positive COVID case and we need to manage it as such.
It's just a scary headline to read, man in his 20s dies from COVID. It could be somewhat misleading, you know.
None of us should be surprised by young people dying of COVID, especially the Delta variant, which is extremely dangerous. It's got over 2 times the rate of hospitalisation, so the severity of illness with the Delta variant, comparing vaccinated individuals with the vaccinated individuals in previous variants, 2.5 times greater. So it's a very, very serious illness, 10 times more lethal than influenza.
Can I ask the Premier a question about the lockdowns? Yeah, go Rich.
Will you consider using, I guess, the public health orders to, I guess, mandate vaccines in some key industries? Will you use those powers? I mean, it's something that, I guess, unions and businesses might be more supportive of if that message comes from, I guess, from a public health measure.
Look, we've done it in aged care. That's under a public health order. We're working to a mandate for healthcare workers, again, according to the national plan, and really the same approach for all jurisdictions. There are potentially other industries that might be in scope in that regard. That said, it is also available to industries and settings to make their own determinations under Employment Law, our Health and Safety Act, to say for our particular setting, our risk, our obligations to both our employees and the broader community is such that we think an OH&S Act initiated mandate is an appropriate one as well.
But if they come to you, I guess if they're a bit reluctant to do it, but if I want the protection, I guess, to make it easier for them, is that something you're willing to do beyond healthcare workers?
I'm not closed off to it. I need to make those due considerations around proportionality and the specific risks in those settings. And the Victorian Charter of Human Rights and Responsibilities is at play in those determinations as well.
Would you be able to do that under the current Public Health and Wellbeing Act, or are you lobbying government to look at new legislation to be able to do this?
It's available under the Public Health and Wellbeing Act, but equally, yeah, it's available under employment law.
Is there any risk that obviously our hospitals are going to be under duress for the months to come? Is there any risk that if you make it mandatory for healthcare workers, some could leave the workforce? Do you have any sense of how many people are adamantly opposed to it?
Oh, it's a small percentage. It's a very small percentage. There'll be a larger percentage who have some ambivalence about it, but we've already got over 80% first dose coverage, so we know that 80% of our workforce have already stepped up to be vaccinated without a mandate in place. Some of them are already booked in for further vaccines, so I don't think there'll be a significant impact on workforce numbers, but it's still to be mapped out, if you like.
On Yom Kippur, New South Wales have made some exceptions to their rules for the Jewish community. We're not doing that here. Both states claim that their decisions are based on health advice, but they're different decisions, even though New South Wales has got a lot more cases than we have. How do you explain that?
Look, it's for New South Wales to make their decisions under public health assessments as they see fit. They are getting to a plateau in their cases. We've been on a steep rise, and in the last couple of weeks a steeper rise than New South Wales. It's setting us on a trajectory which is absolutely a threat to health services capacity. So we have to be precautionary in how we ease restrictions, and we need to consider equity. You know, religious occasions, people feel very acutely and personally, as they should. And I understand that, but there are issues of equity across many of those holy days for, you know, whether it's Chinese Buddhist New Year or Christmas or you know, any other religious holiday, Easter, whatever it might be. You know, we've had Eid al-Fitr, Eid al-Adha, both disrupted by COVID. So, you know, we have to bear in mind that everyone's making a sacrifice here.
Is part of the decision that if you make an exception for one group, you've then got to make an exception for others?
Look, I think if there were space to make an exception in general terms, you would do it on the basis of the significance of the occasion, and you wouldn't make it for a specific group alone, for sure.
Can I have a date that we're working towards here as a state or as part of the national plan when it comes to mandating vaccines for healthcare workers?
Well, National Cabinet will discuss this Friday. Maybe the Premier has more to say on that.
So it's anticipated the National Cabinet on AHPPC advice will confirm healthcare workers right across the country, given the already very high single dose and indeed very high by rest of the community standard, very high double dose, will provide some time, but it would only be a matter of weeks, I think, Mark. So it's mandated, and you've got a reasonable amount of time just to catch up on it, and it would be one dose because obviously there's an interval between the first and the second dose. But a bit like aged care, where we gave people some notice and some time. 17th is the day when that's kicked in, and they've all got to be first dosed. In terms of what we're doing in our aged care facilities, where you're not single dosed, then we're well over 80%. Then you're not working on shift. So I don't think this will be a problem. To the earlier point about will staff not be available, I think a very small number of people might make a judgment that they don't want to get vaccinated. They'll be deployed into another part of the health system. They won't be working in areas where it would be a risk.
On hitting our target on Friday, our 70% target.
I can't quite hear, Chanel,
On
sorry.
hitting our 70% target on Friday, why
Yes.
is it that we then have to wait until Sunday to get a roadmap?
No, I'm not saying that you definitely have to wait till Sunday. We're going to hit our, as I said yesterday, I was asked this exact same question. I think Rachel asked me this question yesterday. We're very close. We're at 68.3. We're very close to hitting the 70. We should do that tomorrow. Obviously, we will confirm for people as soon as we can and make effective as soon as we can. And we've been very upfront about this. I'm not overselling this. It's modest. The notion of extra time and extra distance to be able to travel from home for exercise. If we can go further than that with some social interaction as well, we'll get those. We will get those announcements made as soon as possible. It may well be though that if we roll all this together in the roadmap on say Sunday, we can do more because we've settled on the full context. That would be the only reason we might wait a little while longer. It would only be a day or so. Like, I'll have more to say on this definitively on the weekend. And look, I think it's a good thing that it's not the 23rd when we're going to get to 70%. It's a number of days before that, and that's a credit to every Victorian who's gone and got the shot.
But are you worried that if you don't go far enough with those small changes, that coming into grand final weekend, you'll see people breaking the rules regardless because they want to watch the football with their family?
No, I'm not. I don't think that there's to a certain extent, I think that's a phenomenon. That's a challenge that we're all facing every day, whether it's grand final week or not, grand final day or not. There are people out there that are not doing the right thing. I would just appeal to them. I know it's tough. I know it's difficult. I know we're all fatigued. We want this to be over. But the rules are there to keep case numbers down because that keeps the number of people in hospital down, and it means our nurses have less to do. They've still got lots to do, but they're less than they would otherwise have to do. So I don't care what motivates you to follow the rules, whether it's keeping yourself safe, your family safe, or maybe it's out of respect for those heroes in our health system, for whatever reason, or to avoid a fine. Everyone just needs to do the right thing, and as we push through the 70% to the 70% double dose, 80% double dose, where we have many more options, where we will deliver the national plan and we will be open. It's not a Freedom Day thing, it's not a flicker switch and everything's back to what it was like in 2019. But we have many more options. If we can just keep these numbers as low as possible, that means we keep the number of people in hospital as low as possible, and then we've got options and we can move faster than would otherwise be the case.
Saturday's usually the biggest day of the week for the real estate industry. I think in that 70% first dose raft, there was an undertaking for inspections to open. Can they look forward to being able to do that on Saturday or not?
I can't confirm yet whether this Saturday will be the first Saturday that they can go back to that, but it's our aim to make those changes and to make them in an enduring way. The exact timing and when they come into effect, you've just got to give us a little bit more time on that.
What will unoccupied homes mean under those rules? Does that mean someone's away for the weekend, or are they like vacant and not living in it at all?
I think just common sense. There needs to be no one there when the people are going through. The exact specifications of that'll be there in the orders, and we'll confirm that for you with a precise set of words, but I think common sense drives all of these things. You can't be having people coming through doing an inspection while you're there. That is essentially visitors to your home. This is transmitted from one person to another, and the aerosol transmission obviously is a really significant part of Delta.
Just back on the 70% first dose milestone,
Yep.
If we get there tomorrow, why?
Well,
why
we will get there tomorrow.
Why wouldn't we just relax the rules that you've already flagged tomorrow?
Well, we might, Mark. That's the point.
Oh.
We might do it tomorrow night, but we're not there yet.
Well,
And today's
you
not
also
tomorrow.
said that we might have to wait till Sunday, and I only asked.
Well, we
because-
might. I will be here to announce, as I've done on many occasions, and I know you look forward to it, and I do too. I'll be here to make announcements when we've made decisions. No decision's been made. I want to do all those things that we foreshadowed, and if we can go further still, then we would like to do that. It's a wonderful problem to have that we are going to get to 70% days and days ahead of when we thought we would. That's a fantastic problem to have. Let's just work through that. We will tomorrow, Friday, and then we'll be back here on Sunday anyway, talking about the roadmap in great detail about what September and October, the rest of September, October and November looks like.
Pfizer supplies were due to double in October, according to the General Fruman's office. Should Victoria be doubling its target to 2 million doses next month? Do you have the staff to do it?
A couple of points. One, I would be probably, and I'm not having a go, this is just a fact. The reason I'm not out here as we pass one target announcing the new target is we just don't have our numbers yet. When we get the numbers from the Commonwealth about what we can expect to receive in October, then we'll have a new target. And we may break it down into weeks, if you like, rather than a 5-week thing. It might be a series of shorter-term targets. Because obviously the quicker we can get to 70% double-dosed, the less cases we'll have. Because if the intervening period is a lengthy one, then cases will continue to grow. Vaccines and contact tracing and following the rules, they all play a part. But arguably one lever that really works for us is to get as many people vaccinated as fast as possible so that the case numbers don't spiral, because getting vaccinated obviously means you're less of a risk to give it and get it. Let's wait and see what the Commonwealth confirm as our October allocations. Once we have that confirmed, we'll be able to speak more about what the targets look like. I'm so grateful and so impressed. We set a target. Victorians have answered the call to come and get the jab. 1 million ahead of time and 70% ahead of time, well and truly ahead of time. They are fantastic problems to have if we've got to bring forward some of our decision making. That's why tonight there'll be meetings, tomorrow, Friday, Saturday, all the way through to Sunday when we announce the roadmap.
Do you have enough staff to do that though? Do you have enough staff, vaccine staff, available to actually?
Well, just on I was going to just on the issue of the 2 million. Our target of 1 million was just in our hubs. That's not across the state. There's been many other vaccinations have been done by GPs, community pharmacies really stepping up now that they've got. Well, they will from Monday, I think, have very substantial Moderna stocks. We're already doing twice what we said we'd do. The notion of us going even further, we'll try and do that, but it's not going to be a massive jump. Or we're not going to go from doing 250, 300,000 a week to doing, say, 500,000 or 600,000. We don't have the capacity to do that. But we're doing more than we said we'd do. And if we can go a bit further, we will. But GPs, they're going to get more supply, they already have. And certainly pharmacy gets a lot more of a brand new vaccine that's not been part of our vaccination program.
This probably also relates to supply, but is the state government considering shortening that gap between Pfizer doses at state-run hubs to maybe 3 or 4 weeks?
We always look at the dosage interval, the period between. We've made some changes on advice through an expert process in relation to Astra. I've got no advice to change the period between first and second shots for Pfizer. And I just, again, the briefings that I have and the logic tells you that from no shot to one shot, you get about 70%. So the difference is actually greater between no shot and the first shot rather than the first and the second. Everyone's got to get their second shots, by the way. I'm not advocating not to do that. But bringing second doses forward, it may well be that we're better off to get more and more people first dosed as fast as we can, because we're not dealing with zero cases, we're dealing with a dynamic outbreak, and we've got to try and stop the spread and the growth of those numbers so that when we get to 70 and 80% double dosed and we open up, we're opening up with less cases, not more, less people in hospital, not more. That's the basic logic of it.
Martin Blight, who died...
And politicians don't make those decisions. They're made by an expert group.
Premier Martin Blight, who died from COVID, was meant to be vaccinated 2 days after his death. He'd had that appointment for 5 weeks, made it the first opportunity he could. Have we let him down?
Well, I would send my deepest sympathies and condolences to his family, to his friends, to his workmates. I know there's been quite a bit of discussion today from his union in relation to the fact that he was booked. What I would say is this: he's 46 years old. He was not, someone who had a long list of comorbidities and all sorts of complex conditions. He was an otherwise healthy person. If we opened up tonight, as some are urging us to do, with less than 50% of people double vaxxed, then there will be hundreds and hundreds of stories just like his. Hundreds of tragedies just like his. Otherwise healthy people who are not vaccinated yet. They might have an appointment, they're not vaccinated yet. They're simply not through one dose, let alone two. I don't think the Chief Health Officer would ever provide me with advice to do that. But I wouldn't do it even if he did. Like, we're not. The national plan is 70%. We're not at 70%. It then moves to 80%. Chief Health Officer will not advise me to open up and pretend that 50 is 70, because it isn't. There are a lot of people who've got appointments booked. There are a lot of people who've got one jab and not the second. We need to be faithful to that national plan, and urging people to open up everything against advice as early as tonight. That'll just mean more and more people in their 40s and their 30s, and indeed younger, will finish up in hospital gravely ill. That's not the strategy. The national plan is not a national plan to hospitalise people. It's a national plan to get vaccinated and then carefully and cautiously open up. That's the plan I'm working to.
And the Victorian Ombudsman's investigating the permit system. Is that unfair?
Sorry?
Has the permit system been unfair? The Victorian
I don't make those decisions, and I don't think you want a situation where politicians make those decisions. Bureaucrats, public servants make those decisions, and they're very, very difficult. They're incredibly difficult, and to try and strike that balance is an incredibly emotional and challenging thing. I thank the teams of people, big teams of people who work through the applications for permits, applications for concessions. It's a very, very challenging job to have to undertake, and so often you're having to give people news that they don't want to hear. The Ombudsman's free to look at a whole range of different things, and I wish her well in that work. What I do know though is that the teams of public servants who make those decisions, they take their responsibilities very seriously. They're all doing their best. We are getting people home from New South Wales, and you'll see us make further positive announcements about that soon.
Just on that, so there are over 80 complaints currently scheduled with that. What are we doing to help stranded families? And also, have we got an update on the trial of the New South Wales Victorian border bubble, that home quarantine?
No, I don't
system?
have an update on that, but we're working to get people home as fast as we possibly can. And a proper complaints process is important. Whenever you run a system, people need to be able to voice any concerns they have with it. That's the system working. Beyond that, we have 5,000 to 6,000 people that we want to get home. We will use technology to do that. The ones that were on the border were in some respects the easiest group to start with. We've well and truly started that work. As we then move further north and get right into Sydney, which is the epicentre, the heartbreak, the centre of the outbreak in New South Wales, that's going to be a little bit more challenging, but we'll get everybody home and we'll get everything opened up. It's just going to take us some time, and I think people know that. We can't let our frustration get the better of us. Getting vaccinated is the most important thing to do. There are appointments available right now. Please go online and book one.
To answer that question about the grand final date, how much do you think people are breaking the rules right now? Do you have mobility data and things like that to reflect it? And is there anything you can do to fix that now, or is it just a stage of fatigue and people?
Well, I just say to people, if you make a judgment that the rules don't apply to you, that they're someone else's job to follow, then we'll be in lockdown longer, and we'll give our nurses an impossible task: thousands and thousands of patients to treat. Let's not make the job of our nurses and our doctors and our AMBOs and all of those health professionals harder than it needs to be. Let's have less cases rather than more. Let's have less people who are gravely ill rather than more. That's why the rules are there. We're all sick and tired of this whole pandemic. I get that. I understand that. But, if we follow this plan, and we will, then we will get to the other side of this, and we'll do so with fewer people dying, fewer people gravely ill, and less impact on all of us in many ways. Because, as I've said to you so many times, if every bed is filled with a COVID patient, all the non-COVID patients who need a bed, for the best of reasons, people who've had an accident, people who have had a heart attack, people who can't wait 4 weeks or 8 weeks or longer for urgent cancer surgery. People who've had a stroke, mums who've given birth to a premature baby, all of these things, they get bumped as well. Their care gets compromised if the system is overrun. That's what so many other countries around the world have confirmed for us. It's not a matter of speculation. We've seen this happen in other parts of the world, and we've got to do everything we can to avoid it happening here. That's what these rules are all about.
Just on a non-COVID matter, the ransomware attack on Melbourne hospitals, including Eastern Health, has been referenced in the federal annual cyber report.
Yep.
What's the government and the department been doing to ensure that something like that doesn't happen, particularly as hospitals have a huge strain at the moment with COVID?
Oh, they do. The Securities and Emergencies Committee of Cabinet has received briefings on these sorts of matters over time. I don't have an update and I don't have a brief on that report, Simon. I'm more than happy to chase it up for you though. But we take cybersecurity very seriously, and that's why we've worked very hard to do everything we can to make sure that our systems have got protection. It is a big challenge though, and I'm sure that report references that.
The proposal for a code of conduct for political parties, MPs and staffers for online behaviour, social media, as recommended yesterday?
Well, the Electoral Matters Committee have provided a report. I will freely confess, Rich, I have not read that report. I've read lots of reports in the last 24 hours, but not reports from the Electoral Matters Committee, as august and as important as they are. My views on social media are very clear. If you've got something to say it and put your name to it. And I've called out bad behaviour. When people have gone after critics of mine, I have gone and made the point that that's not the right thing, not the right thing to do. So we've got to look through that and we'll respond in due course.
Mandatory jabs for truckies come in next week.
Yes.
Is there any monitoring on how many interstate truck drivers actually have had the jab, and will we have any supply shortages as a result?
No, I don't believe we'll have supply shortages. We're already testing freight drivers regularly. If not for a very practical issue, we would have been doubling up on the testing and doing the jabs at the same time. But having someone get a jab and then drive off in a prime mover can be a bit challenging, because there will be a small percentage of people who may not feel so good after they have their jab. But we've got adequate supply, and we will get all of those workers who are doing an amazing job, and I thank them for the work they're doing. But they know it. They are a risk because they're moving around the country, and the virus can sometimes hitch a ride with them.
South Australia.
No, we're going to go over here.
Sorry.
Premier, given there are 2 Melbourne workers who've been working in Greater Geelong supermarkets while unknowingly positive, what is the government doing to limit the movement of workers between metro and regional areas?
Well, it's very difficult to limit the movement between metro and regional areas if you are an authorised worker. There's obviously reasons to go to regional Victoria, so we are limiting movement. You can't just decide I'm going to go to the country today. You've got to have a reason to. But beyond that, what we've all come to learn and understand is that our economy and just basic daily life is really about those really fundamental and basic things, like who's stacking the shelves, who's taking all the stuff we eat and buy and need to survive from the warehouse to the supermarket, all of those sorts of things. So there's a lot of activity that is authorised. It's not zero risk, but the alternative would be, well, the alternative would be that the shelves of the supermarket would have nothing on them. And that obviously presents really significant challenges. But our supermarkets have done a great job in keeping their staff and their customers safe. I'm very grateful to them. We're currently vaccinating in partnership with all the big supermarkets and Metcash as well, all their staff. But there is some movement, and there's no way to have zero movement.
South Australia, Western Australia and now Queensland have moved to make Pfizer available for over 60s. As a nation, should we be prioritising the preferences of vaccine shopping baby boomers over younger people in states like Victoria and New South Wales with outbreaks who can only have Pfizer?
Well, I won't take up your turn of phrase, Rachel, as that may not do any of us any good, but what I would say is this is a perfectly good vaccine available for people over 60, and I support what the Prime Minister had to say recently and what he wrote to all of those 60 and overs. You have a vaccine. It's the AstraZeneca vaccine. Please talk to your GP or come along to a state clinic and talk to a senior nurse immuniser, a pharmacist or a doctor, and we'll talk you through and hopefully all of those issues, and you can make an informed choice. It works. It is absolutely effective. It's made here. It's available. I've pushed it, we've all pushed it, and more than 1 million Victorians are double dose protected by the AstraZeneca vaccine, and I think the majority of those have been double dosed through state hubs. There's a perfectly good vaccine available, and I don't believe that you should be, this is my judgment, I'm not being critical of what other premiers do, they can do whatever they choose to do, but what I'm explaining what we're doing, I'm not going to take a vaccine that is the only one available for 12, 13, 14, 15-year-olds and give it to 60-year-olds when 60-year-olds have got AstraZeneca that they can access. And I'm pleased to say many, many tens of thousands, perhaps more, have been accessing. That doesn't make any sense to me.
Will there be any monitoring of people trying to leave the Ballarat area, more police or anything like that?
Yeah, police will be out in force, just making sure that people have got the support that they need and that people are following the rules. The rules are there to protect people. If everyone in Ballarat follows those rules, then the lockdown can be off quite soon, just as it came off in Shep. They followed the rules, they stayed at home, they looked out for each other and looked after each other. And we had lots of support up there for them. The same will work in the Ballarat community as well.
Can I ask a question on...
Yeah, absolutely.
Yeah. Oh, yeah, go for it.
Yeah, just on the construction industry, sorry, just one more. It was planned to increase to 50% capacity when 90% of workers receive the first dose. Yep. In light of these recent breaches, do you...
I think it's highly unlikely that the construction industry is expanded in the next few days. I think it is still a very live matter about whether 25% can be made safe, and that's really back to the industry around getting vaccinated, wearing your mask, having a COVID safe plan and taking it seriously. Like, you know, we have over many decades changed culture on building sites large and small where safety is now second nature. It is absolutely important, but we can't have a situation where people are wearing a hard hat and high vis and their mask under their chin. These things, all of these safety things have to be taken seriously. We've been speaking with the industry all week. I think it is highly unlikely that I will get advice to go from 25 to 50% right now. I want to be able to take that step. That's not going to happen in the next couple of days.
I'll go the other way then.
But it can happen. It can happen, and we'll have more to say about when we think it will happen when we do the roadmap on Sunday.
So the fact that New South Wales shut down the industry when there was an outbreak, is this something that we would potentially consider?
I hope it doesn't come to that. I'm working very hard, and so is the industry, to make sure that we don't have to do that. If people get vaccinated, if people follow the rules and take their COVID safe plan seriously, then I'm very confident that we can keep the industry open, and in fact we can take graduated steps to get to 50%, 75% and get back to something approaching 100% as soon as we possibly can. I just don't think that's going to be possible in the next couple of days.
Who passed away overnight. Yes. Was he vaccinated, and was he in hospital or at home?
I'm not certain, but if it doesn't breach his privacy, I'm happy to get you some more details. I do have some, I don't have details on that person. I do have some details on the younger gentleman, because that's been, I think, been a matter that's been raised with us. And you know, this is a 46-year-old, otherwise healthy person, booked in to get vaccinated, hadn't been vaccinated yet, and that represents like half the Victorian community who want to get vaccinated and will, I think, get vaccinated. They just haven't been vaccinated yet. And if we opened up everything today, much as we'd like to, much as we've been urged to by some people, we would finish up with so many more 46-year-olds and younger who will get really, really sick. And, you know, every death's a terrible tragedy, but let's never forget as well, there's many people who will get this, be gravely unwell, and carry the consequences of this almost as a chronic illness for not weeks, but months and months. We've got to minimise that. We'll do everything we can to minimise that. The good news is the vaccine is so effective. Go and book an appointment. I don't have an exact number of appointments that are available. They didn't give me one this morning. But I know there'll be thousands of appointments available right now if you just go online and book and be like 1 million other Victorians and get double dose protected with AstraZeneca, or be like one of nearly 2.9 million Victorians who've been to a state clinic, double what we said we would do. We're very pleased to keep on doing that important work. Any more for me?
Sorry, just one more if that's okay. Do we have a figure on how many people are receiving hospital treatment at home?
No, but I can try and find you one. We have a pathway. There are a lot of positive people who don't need to be in a hospital bed, and the easiest thing to do is to support them at home. But they're known to the system. They're linked to the system. It's called a COVID pathway. So if they deteriorate, and they can deteriorate quite fast, then It's not like they're turning up unannounced. That there is a pathway for them to have the care that they need. Let's try and get you some more information on that. We can do that offline. That's it for me then. You just want the Chief Health Officer for another half an hour or so, yes? Brett?
There's been multiple childcare centres listed as exposure sites in the last few weeks. Are we seeing those cases turn into bigger clusters, and what gives you confidence that there's still safe places to remain open?
Look, they're essential places. Childcare needs to happen. We know that it's permitted for children of essential workers and of single parents. We haven't seen really explosive outbreaks aside from one. And in general terms, they're not quite as prone to significant transmission as some other childhood settings like primary schools. So we just need to manage the risk of those places that continue to be open for essential reasons.
Do you consider making vaccines mandatory for childcare centre workers?
Look, as I say, none of it's off the table. Again, the industry might want to make that a priority from their perspective. The thing about mandating vaccines is you need to get all of the other levels right. Accessible, affordable, compensated, if people are taking time off work or need sick leave for the 12, 24 hours after they receive the vaccine. You need to engage with them, you need to provide information. When you've got all of that done and you're still seeing a significant gap, then mandating might be something that's a consideration. Again, bearing in mind equity and what it means to penalise people by not giving them access to a premises or access to work.
Just on Ballarat, you guys have previously said before that sending vaccines to respond to an outbreak doesn't necessarily work, playing whack-a-mole doesn't necessarily work. Why send extra vaccines to Ballarat now and not necessarily more to the west or northern suburbs if they still need them?
Oh, look, we can do both, and we are. So there's a whole lot of vaccines going to the north and west in their tens of thousands of doses. We know that there'll be a demand for vaccines in Ballarat out of this. So in many ways, we are just making sure that we're meeting that really significant demand. It's not about chasing the very outbreak settings and providing vaccines at those settings, but making them available through the hub that is open and operating in Ballarat is a really good idea, because there'll be many, many thousands of people stepping up to get that vaccine.
One more really quick
do we know how many extra vaccines are being sent to Ballarat?
I think it'll be a few thousand over coming days, but we'll work through that.
In Ballarat, the Health Department website says that there are three active cases in Ballarat, including the 2 new ones today. Is there one of those 4 that you mentioned that's no longer active, or is there perhaps one that's in the neighbouring LGA of Hepburn?
Yeah, we can look into it. I think it might be Melbourne resident who'd been to Ballarat, but we'll come back to you.
So there are only 3 resident cases in Ballarat then, is that?
Do you know?
So I think, as the Chief Health Officer said, we had 4 active cases in Ballarat. One of those was a Melbourne resident who briefly and legitimately came to Ballarat. There are 3 cases in the numbers today. So 1 case identified yesterday, 2 tested positive yesterday, all in one household. We have got a further household primary close contact of that family who lives in another household. They've also turned positive. They've turned positive today. They'll be in tomorrow's numbers. So that gives us 4 active cases right now. There'll be 3 on the website.
Cool. Thank you.
Is that it? Great, thank you.